And so I don't want anybody to worry about menopause transition, because there are ways and things that you can do to manage that if it's impacting you, the same as a bad period, the same as going through puberty. We all need to be aware of is cardiovascular disease, osteoporosis on your bones, dementia, all these things. If we don't change our lifestyle, we'll have a higher health risk. And because we're staying in the workplace needs to address this as well, because sedentary working in the workplace, like you're saying, working all hours and not switching off, they are going to increase our health risks again, and therefore more sickness absence.
I'm Shreya Parekh, and you're listening to Empower Her, the podcast for busy women aged 35 and beyond. If you're feeling stuck and unfulfilled with your health and wealth, get ready to be empowered to take action. My guests and I will be providing you with knowledge, resources, and ideas to help you broaden your perspectives, learn more about yourself, and define your path to live your absolute best life. Be sure to hit that follow button to stay tuned with Empower Her, and check out the valuable free resources available on the website to support your journey. Stress can be the cause of many mental and physical health problems, and yet many of us don't take the time out, or simply can't take the time out, to address the issues and take action to reduce or eliminate our stress. Although some stress and stress responses are normal and important for the body, a lot aren't. Join me today with Emma Persand as we talk through the effects of stress, both mentally and physically, the symptoms, and how to recognise if you're going through it in the first place, and also how your race, ethnicity, and the menopause fit into this. Emma is a multifaceted healthcare professional and Queen's nurse whose career spans various aspects of nursing, advocacy, and education. She's also the founder and director of Lemur Health and delivers comprehensive courses tailored for healthcare professionals, managers, and employees. Join us in this insightful conversation to help you recognise and reduce stress. Emma, welcome to the Empower Her podcast. It's great to have you on. I'm really, really excited to have this conversation because it's something that affects a lot of people, and I know it can be a natural thing as well, but you know, the serious side of it can be quite dangerous, really. Could you please introduce yourself and talk a little bit about what you were doing and what you're doing now? That would be great. Thank you so much.
Yes, so hello, my name's Emma Persand. I am a registered nurse and a Queen's nurse, and I also have the British Menopause Society certificate in specialist menopause skills. Not got my teeth in this morning. And also certificate in cognitive behavioural therapy for menopause symptoms, which will become apparent of why I have those certificates. So my expertise is occupational health, supporting employees' health and wellbeing in the workplace. And it was actually menopause and coming across an employee with menopause symptoms that changed the direction of my career in a light bulb moment. So at the moment, I work for myself. I support organisations. It isn't just menopause, it becomes a wider conversation. It's about all the diverse needs of individuals in the workplace so they can stay and thrive. And businesses have support with their talent and retention and attraction of talent.
Yeah.
So that, and I also do individual sessions for the people who do suffer from symptoms of fluctuating hormones.
Yeah, that's great. Thank you. That's a lot of stuff you do. So today I really want to focus on the topic of stress, okay, and the effects of stress. So can you just highlight what that means? You know, we all, well, I shouldn't say the word all, but a lot of people say, I'm really stressed out. But how do you differentiate between I'm really stressed out and you actually have a problem and you need to be seen or you need to do something about it?
So stress is obviously one of the biggest causes of sickness absence, of relationship breakdowns, mental health is, you know, one of the biggest causes. But stress is actually not an illness. It's not a condition. It's a set of factors and symptoms that come into place where they seriously impact your daily life, so you can't function. And it's when you can't function in your daily life due to symptoms of low mood, anxiety, social anxiety, forgetfulness, inability to cope. It's your feelings that the stressful, or the situations don't have to be stressful, the situations that you're facing, you don't have the ability to cope anymore. That's when it becomes stress. And we all have that. And we need stress. Stress is good for us. Eustress is good stress. It's EUSTRES, eustress. But what happens is we go into distress, and it's a continuum. So it's recognizing when we need eustress, like if we need to perform in an exam, an interview, a race, we need that good adrenaline and cortisol response. Distress is where we have those responses and there's no threat and we don't need to raise our game. So that's stress. In relation to diagnosing it, unfortunately, it's when somebody feels like they've fallen off a cliff that they say, I am really stressed.
Mm. What are the kind of mental and physical responses to look out for when you're in stress mode? And I should actually say maybe in distress, because that's the key thing. You know, a lot of people say I'm stressed out because I've got an exam. I'm stressed out because, you know, my kids are doing my head in, as an example, whatever, right? But that might just be kind of minor stress, but you feel like it's a big stress. But like you mentioned, and actually that's the key thing that you mentioned that I didn't actually acknowledge myself, distress is the one to really think about, and really that's the word I probably should be using, maybe.
I'm in distress rather I am stressed.
Yes, exactly.
And language is important, even though if someone says I'm really stressed, I'm not going to sit there and go, okay, can we look at the continuum? Can you, I'm not going to say that. I understand that we don't use the word distress. The symptoms are, they're individual. So they're the same as everything else in our life. We all experience health and ill health in our own unique way, and it's different. So for someone who's really stressed, you would assume that they have an inability to get up, an inability to face the day, feeling overwhelmed, insomnia, or waking up at 3 o'clock in the morning and not being able to go back to sleep. They may lose their appetite. They may overeat. You can get physical symptoms: skin, eczema, psoriasis, hair loss, palpitations. You can get the physical sensations. The mental sensations are inability to concentrate, lack of focus, unable to remember things. And then there's an emotional response where you may be quick to anger or quick to cry. So it's different for everybody, and it's understanding yourself that this is not normal for me. Yeah. However, you may get somebody that all of a sudden takes care of their appearance. They're really distressed. So for them to feel in control is they'll wake up at 6 o'clock in the morning to have a shower, do their hair, and they come into maybe the workplace, or it might be a friend, and they look immaculate. You wouldn't say that that person was stressed normally, but actually if that's altered for them, it's like a child being really organized for school, having their pens, having done all their homework. That might be a sign of distress rather than someone who can't get out of bed. So it's knowing individually what your normal responses are to your normal everyday life. And when they flip, when you become the opposite of that, that's when you're in distress.
Yeah. And what are the kind of common symptoms, if there are any kind of common symptoms to look out for with stress? And also, I want you to kind of emphasize, or not emphasize, but point out the difference. You know, I know you're knowledgeable with the menopause, and how can you ensure that those symptoms aren't getting confused with menopause or perimenopause symptoms, because they can often get diluted, if that makes sense.
No, and that's a really good question, because that has been the problem. So midlife women and GPs are more likely to attribute all those symptoms that I talked about to distress rather than perimenopause or menopause. And it was precisely that is how I've ended up doing this work. It's about 10 years ago. I used to work for a large NHS trust occupational health department. And because I'm also, I've got a qualification in forensic nursing. I used to work in police custody and to do fit for interview mini mental health assessments. Moving over to the NHS into occupational health, surprisingly, was not much different. The amount of work-related stress and mental health issues. So anybody that had any complex work-related stress was referred to me. I wrote the prevention and management of work-related stress policy for the trust and rolled out the management training on how to manage the mum. And it was a case, she was 41, she was a senior doctor, and at the time my area was going through devolution, and so there was a lot of national focus on us. And she also gave a public speaking, she had a forward-facing role as well as clinical. She had 2 young children under 5. She had a husband who worked full-time, and she had a mum who needed some elder care. Quite rightly, in the NHS, her symptoms of insomnia, low mood, social anxiety, the inability to stand up in front of people and speak, whereas previously she'd had no issue, became overwhelming, and she ended up taking some time off. Now, when you have time off for distress, it's called an acute stress reaction. Because stress is not an illness, it's a reaction. If you monitor and change the parameters that have caused that stress reaction, you should get better, and it should not happen ever again, because it's not a mental health condition. And so that this acute stress reaction, there's a definitive way of treating it through the GP, occupational health, and manager. And if you all work together, it's phenomenal. Now, she had a really good GP. She was seeing me regularly, and she was complying with everything the GP said and prescribed. And her manager was regularly checking in on her, and she wasn't getting any better. And this proactive GP 10 years ago said, I think you're perimenopausal. Now, I'd never heard that term. I thought quite wrongly, menopause, you're nowhere near that age. And she thought it, she still hadn't discounted having another child. And they changed the treatment pathway from an acute stress reaction of work-related stress to perimenopause and menopause, and her symptoms revolutionized overnight. And a light bulb went off in my head, and I thought, so to cut a long story short, I went, and there was nothing, because healthcare professionals don't get any, menopause was not on the curriculum of our training.
Yeah.
There was nothing out there. So I ended up training under the British Menopause Society in specialist skills. So I understood not to become a specialist, but to bring it back in the workplace. And that's when I found out, and we're all aware now, because 10 years ago, you couldn't say the word menopause. Now, it's wonderful, it's out there, but we need to change the narrative a little bit and make it a bit more inclusive of all experiences. So what you might, to answer your question in this long-winded way, is you have to diagnose what it isn't before you diagnose what it is. So anybody 40 and under, and potentially to 45. Now, the NICE guidelines say 40 and under, but some GPs will go up to 45. You can do the hormone blood tests, where you are measuring your hormones at 2 points in your life, 6 weeks apart, to see what your hormone levels are. Now, 40 and under, that's a definitive test, because 40 and under of menopause is a medical condition. It's not a natural process. So 40 and under, it has to be diagnosed with hormones. 40 and over, and definitely after 45, it is pointless doing hormonal blood tests, because you are fluctuating so much, and they do it twice. If they catch you at the time when your hormones are right, they're going to say, oh, you're not perimenopausal, and you won't get proper treatment.
Yeah.
So what they say is, you take blood tests for everything else to rule out what it isn't. Thyroid symptoms can be exactly the same as stress and perimenopausal.
Right.
Diabetes, all of them. So you have a whole range of blood tests, and if they're all normal, it is likely to be your hormones. So that's how you do it. So it's ruling out what it isn't to know what it is.
Right. Okay. Yeah. I mean, that makes total sense. But it's kind of, for a lot of women, it's potluck as well, in the sense that when you go to your GP, you know, how often do GPs recognise that you could be perimenopausal, even if you are, under a certain age? And then, my next question is, to do with your race. Okay. And, being menopausal and your race, there's the timelines are quite different. Well, they can be different. I'm not saying for all women of different races, but generally speaking, the timelines are quite different from, with different races that come into play. And not all GPs may know this. They may just be going with a kind of black and white view of menopause. And menopause really isn't black and white, to be fair. So, the question is, how does race come into this, as in your race? Not your race in particular, sorry, I mean people's race in general. And how does that also, correlate to stress as well? So does people's, that people's races kind of stress response and the effects of stress and being stressed in the first place, is that different as well?
Wow, there's so many things to answer in that. So race, ethnicity and race is a big factor. Biologically, because Black and Asian women are likely to go through the menopause transition earlier than white women, shall we say, Caucasian women. Even if Black and Asian women have been born in the UK, or Black and Asian women that live in their original country, if you like. So I'm mixed race, biracial. My dad's Mauritian and my mum's English. So I have inherited the genes, unfortunately, of South Asian, where I'm more predisposed to diabetes and high blood pressure. So that comes in, okay? But I grew up in the UK. So the culture of where I live comes in.
Yeah.
So the British Menopause Society, because it is different for different women, of not just where you were born, it's the culture you've been brought up in as well, because it can influence your symptoms. They have a specific guide for menopause care for Black and Asian women. And like you've just said, the problem has been, we've got some phenomenal GPs, and I'm not going to GP bash, because the changes that have happened over the last 10 years have been led by predominantly women. It has been women standing up, but also some GPs, some occupational health nurses, some nurses that have done this change. But quite rightly, some GPs don't know much about menopause anyway. And then they certainly don't know much about the individualness of menopause, if you like, of different ethnicities, the socioeconomic factors that can come into it, everything. Postcode lottery of whether you're allowed, you can get treatment. So Black and Asian women, so menopause is one day in your life. That is it. We talk about menopause, but that's just one day. It's the transition we're talking about. So menopause is 12 months after your last period. So unfortunately, if you've had a period 11 months after your last period, you're still going to wait another 12 months. And that's really important, because the highest demographic of women or people who can get pregnant having unplanned pregnancies is women in their 40s. So, sorry, the second highest. The highest is teenage pregnancies. The next is women in their 40s who may think they're menopausal, or the periods become so erratic they don't know when they're ovulating. So that 12 months, traditionally for your average white person, is age 51. But we now know that is a lot earlier for Black and Asian women. So 45 onwards, 46, 47, everybody's different. So I'm saying all this, everybody's different, but generally. So what would happen is, because the media says, oh, menopause is an age-related illness, disease, however it's pitched, around about the age 50, 51, 52. Someone who's Black or Asian, who's suffering from these symptoms that we've talked about at age 44, 45, are not going to recognise that or associate it. And then the GP is certainly not going to. So in the UK, the most prevalent symptom was hot flush. And I think brain fog is hitting that the same at the moment. But actually, Black women in other countries, Indian women in India, hot flush is not the number one symptom.
Okay.
So the culture comes into it. In Japan, the number one symptom is shoulder pain. Now, they have hot flushes, but they don't report them to be as problematic as UK women. Now, I don't know whether that's actually Japanese culture or women who were born in Japan. So there's more research to be done on that. And that they think that's a combination of factors because of soya is a phytoestrogen and a natural estrogen. And so it has an estrogenic effect. And in Japan, soya is a key part of their diet, but you have to have it from birth. So there's no point in me and you starting to introduce soya now to manage our symptoms because you have to have it from birth, and they have a different lifestyle. So in Japan, shoulder pain. Now in the UK, if you went to the GP with shoulder pain and I went, we'd be go down the orthopedic route. It wouldn't be on the menopause or perimenopausal pathway. So there's lots we don't know. So women need to, and those, because I say women, but we need to be inclusive. It's women, it's non-binary, it's intersex, it's trans men who have a uterus. So it's including everybody in the medical conversation. It's not about the social issues here, it's about the medical conversation. And anybody who has estrogen and progesterone that can fluctuate up and down will need support. So it's about us knowing our body, understanding it. So it starts with self-care. If you are having all symptoms that are affecting you, like we said, physically, mentally, emotionally, you start with your self-care. And we all know what we have to do with self-care, but the problem is we all don't do it.
Yeah.
We all of us, when I'll say, these are the things, it's your sleep, your diet, your exercise, try yoga. All of us would just want to go, oh, please, can I just have a pill that will fix all this because my life is so busy. I can't do self-care.
Yeah.
But if you put all the self-care practices in and you still have those symptoms, that's when you go to your GP for intervention. So, right. I mean, we could talk about self-care, CBT all day, but there is a difference between ethnicity and culture and race in how we experience menopause symptoms. And can I just say, some women do not have any symptoms. I'm very conscious that we might be scaring a whole demographic of women in their 20s and 30s before they get to this transition stage. Yeah. It's like puberty. Puberty, everybody experiences it. Some people fly through it. Some people have a horrendous time. And that's exactly what we're talking about today.
Yeah, I think, you're so right. The whole topic of menopause now, first of all, I personally think the word menopause should be called, like you said, the transition before, because menopause is just that one day where you don't have periods for 12 months and that's it. And then you've got the pre and the post stuff going on. And I think maybe that's where the confusion lies as well. And it doesn't really help in the media now. It's great the conversations out there that that's fantastic. But I think there's still a lot of things going on in the media in terms of the miscommunication, or the words being used aren't the correct words as so much, like we talked about stress and distress, differentiating between the two. And with the race thing, you mentioned the shoulder pain. Oh my God, I'm not Japanese, but I've had shoulder pain for years out of the blue. And I go, and I've been through the orthopedic, I've been through, and they say, you've got this and that or whatever. And now I've got jaw pain and related to, anyway, it's nothing serious, but now I'm just thinking it's probably perimenopause, and it's not a common symptom. And like you say, all the symptoms, symptoms are going to be different for different people, and it's so difficult to diagnose. But then differentiating between the ethnic groups and your race is really important. for people to understand, so they get that idea of, okay, actually, maybe it could be, you know, the age range, and then you've all of a sudden getting these different things. Maybe we can look at, you know, this, that, and the other. And like you said, what did you say before? You have to take out.
You have to rule out what it is before you know what it is.
Exactly. And that kind of hits the nail on the head, really. I think that is exactly what is needed. With the stress part of things, though, does your ethnicity and race come into that aspect? Because I know, are certain races and ethnicities more prone to becoming more distressed?
For that, I can't speak for all races. So the effect of distress over a long period of time influences your health outcomes. So you're more prone to chronic diseases.
Yeah.
And this is where the culture comes in to this talk, and this is probably what's missing a lot from menopause or any other conversation, really. We have a culture of I want to have this a meaningful, open conversation. So Black and Asian people, or people who've gone through trauma. Now, I'm not saying that Black and Asian people have gone through trauma, but the responses are similar, and it does impact the body's physical as well. So it's called epigenetics. I'm not an expert in this, but I do know that Black Americans are more predisposed to diabetes, hypertension, strokes, not just because of diet or lack of money to be able to put towards a healthy diet, but due to the culture of racism, the perceived action of racism, even if they're not experiencing it. And that's because when your body, well, one of the reasons, it's not the whole reason, when your body's under threat, you release a stress response, which is cortisol, adrenaline, your heart increases. Now, if your body's perceiving that you are in a threatening culture a lot of the time, you're going to have a stress response.
Yeah.
And that becomes chronic. Now, in the UK, that is evident as well, that we are aware. I don't know what the impact is or the effects on people, but we are aware that we do have a culture of racism, institutionalized and structural. That became apparent in COVID when more Black and brown nurses and doctors died. It becomes apparent in reports that come out from the NHS that there's still racism. And I'm not blaming an individual here for this. It's just the culture and how things have come up. Now, with that, you've also got different cultures' approach to mental health and stress and distress and eustress. Some cultures do not recognise stress, if you like. 10 years ago, 15 years ago, you couldn't say stress in the workplace because you were seen as weak. Within my career, some companies, years ago, talking about, would have mental health strategies or say the word stress because they felt it gave people license to have time off when there was nothing wrong with them. We now know that 1 in 4 people will have psychological symptoms that impact them, and everybody has mental health. We all do. Same as physical health. We're on a spectrum. We need to support people. The same as sexual and reproductive health is exactly the same. But race, ethnicity, where you were born, the north-south divide in England, access to healthcare services, that's when the cultural impacts come in with all how to deal with this. That's why it's not one size fits all. There's no solutions to go in and say, we can give you solutions to support in mental health or menopause. It's having the cultural conversation. So culture is very much part of the stress conversation, how the culture sees you, the society you've grown up with, your own attitudes and beliefs, your own approach to your health. So it's not just about going to your GP and getting fixed. A lot of it is about self-care, belief in attitude and exercise, unfortunately. It is exercise.
Yeah, absolutely. Yeah, and obviously, your nutrition and things like that. It's such a difficult one because people, like we talked about, a lot of people are busy, and when they're busy, it's usually, I think, stems from the fact that, they're busy with work, as in working for a company, whatever that company is. Okay, not talking about corporates. You could be working in a supermarket, whatever, and all you've got time to do is make ends meet. Go into work, come back, cook, clean, go to bed, start the day again, and there really is no bandwidth for the exercise. And then obviously, if you're on a budget, a lot of healthy food costs a lot of money, and it's so
Yes.
easy to get the microwave meal or just something really quick and cook it. And I feel like, I had this conversation with my previous guest, it's like a collective effort. It's not just, yes, we have to take care of ourselves, we have to take that responsibility and own it, but sometimes it's really difficult if you fear your workplace knowing about it and saying, look, I need to take care of myself, which means I need to only work 9 to 5, like dead on, and that's it. And when I come home, it's my time. Because most people, I think not most, but a lot of people do come home, quickly cook, do what they need to do with the kids if they've got kids, or if they're looking after an elderly person, and then get back on to work.
Yep. And that's so, there's never been a time like this for a woman ever in the history of human evolution. We have never lived this long. We have never lived, we've never been in the workplace like we are now. Our children cannot leave home because of the financial situation. So at 18, 19, I left home easily, bought a house on my 20s. That is not available for the younger generation. Our parents have never lived this long, and unfortunately our parents are living with chronic illness. So a midlife woman, unfortunately, will not only be holding down a job, she cannot retire because of financial inequalities, and also they keep moving the retirement age.
Yeah.
She probably still has children at home. She may have elder care, and also her hormones stopped. Quite rightly, you can't just fix the person. The culture in society and workplace has to change to enable us to thrive. When I say you need to make more time for yourself, I am sure that some people want to beat me over the head with a stick, because when the best thing you can give somebody that is in distress or coping with all that is time for themselves, time to reduce your cortisol and adrenaline response through your breathing. I know that sounds very, very simple, but actually stepping down from your stress response every day so it doesn't become chronic is really important. So, and we're talking about midlife women here, and we need to enter into the conversation about menopause when it's not midlife, because that's a conversation for a lot of people in the workplace at the moment. And I think to include all experiences of menopause transition and all the impacts that has, we need to talk about when menopause, when your periods stop, when it's an unnatural event, when it hasn't happened naturally between the ages of 45 and 52, say. So extending the conversations through empathy and understanding is how I end up training in cognitive therapy for menopause symptoms. I'm not a therapist. It's a 6-week course for breast cancer survivors, because some breast cancers are estrogen dependent, and so of course they block their estrogen, they're estrogen blockers as part of the treatment, and they get plunged into menopause overnight, surgically induced after a hysterectomy. Some endometriosis treatment it'll induce a temporary menopause, and sometimes it just happens under the age of 40. Those people experience huge symptoms because it's not a gradual deterioration of hormones, it's overnight. So they're hot sweats, painful joints, brain fog. They're the ones that really suffer in the workplace and that need the understanding of hormonal fluctuation. So extending this conversation about menopause and stress, and it isn't just midlife, women experiencing it, it's just literally people whose hormones have stopped or fluctuating. Once we get that to normalize it, it'll become a normal event like puberty.
Yeah.
You know, we don't have menopause policies, which I welcome. You don't need them, but I welcome them because it acknowledges, but we don't have puberty policies at school. Perhaps we should to support young girls starting their period and young boys going through their changes. Perhaps we should.
Yeah. Yeah, I think, you know, that there is a lot of work to do, and it's difficult to implement everything and consider every scenario, every type of person. You know, it's a big thing to do. But I think women are now having a voice, they're getting their voice out there. The only other thing I worry about is all these things, you know, generally through the media, you know, especially social media, you always hear typically the severe symptoms, right? Or the typicals, oh, you know, I've got hot flushes, I've got this and I've got that. And it's the people that are maybe approaching perimenopause or in it and aren't really getting those symptoms so much, and then they're starting to fear that they're going to be like this when they completely might not. And I wonder whether that seed planted into your head that this is what I'm expecting to have this and this, you end up kind of getting it anyway because that's what's in your head. I don't know.
Yeah, I mean, there is an element of truth in that, isn't it? You know, if you're going to expect it to be bad, it might be bad. And that's where this, again, extending the conversation, no one sails through menopause transition, no one. So you might not experience any physical symptoms, emotional, behavioural, but the reduction of estrogen protection in your body will increase your health risks naturally. That's going to happen to everyone.
Yeah.
And so we are more likely to die of a heart attack than men. We have the same amount of heart attacks than men, but we're more likely to die. Breast cancer is a big cancer in the UK. And if you ask any woman in the world, if you ask any woman what she's worried about her health in the future, she will say breast cancer. You're more likely to die of a heart attack. And we don't consider that narrative. And that's post-menopause, that's post-transition. And so I don't want anybody to worry about menopause transition because there are ways and things that you can do to manage that if it's impacting you, the same as a bad period, the same as going through puberty. What we all need to be aware of is cardiovascular disease, osteoporosis on your bones, dementia, all these things. If we don't change our lifestyle, we'll have a higher health risk. And because we're staying in the workplace needs to address this as well, because sedentary working in the workplace, like you're saying, working all hours and not switching off, they are going to increase our health risks again, and therefore more sickness absence. So I was part of the British Standards Institute. It's the first standard on menstruation, menstrual health and menopause in the workplace guide. And it was released last year. And it was awarded, I don't think it won, but I think it was awarded one of the best it was nominated for a best standard in the country. It's now going to go to international standard. Now that's amazing, you know, but a bit bizarre that we have to have a standard that acknowledges menstrual health, menopause and menstruation. So companies, if they want to use something or they want to start, there are lots of toolkits out there, as well as telling women how to fix themselves. There are lots of toolkits and resources available for the companies and businesses. So menopause, like we've just said, is one day in your life. We're actually talking about the biological, physical, mental, cultural response to being female, a woman, or identifying as a woman. And we have a responsibility with our lifestyle, our nutrition, our mental health, to prevent the health risks. So even though I'm talking about menopause, I'm actually talking about broken hips. I'm actually talking about incontinence. Incontinence, 1 in 3 women, due to the reduction of estrogen. So it impacts your vulval, vaginal area, your bladder. So you're more likely to leak. These are all fixable, and we don't need to go through it. So even though we're talking about menopause today, I'm actually talking about improving your health long term, and the way to do that is addressing the menopause question.
Yeah, absolutely. So what would be your kind of top tips, or just, general advice for women to, one, identify their stress, okay? Knowing the difference between I'm stressed or I'm distressed, and what steps can they take to do something about that? And then also, if you're in your midlife, what tips you give to kind of identify, is this my menopausal symptoms, or is this actually I am in distress?
So the midlife one is the easier one, because it could be fluctuating hormones. Like I said, you put all your self-care strategies in at first, so if you're able to. So it is reducing your stress, it is increasing your exercise, it is your nutrition, it's knowing what will aggravate, like you stress eat, we'll eat, it's so you eat little and often, instead of downloading lots of nice carbs or fat that we all want to. After you've had a rough day, and you come home and you think, oh, I could really do with a glass of wine. Quite right, you feel stressed because you've had a really rough day, and then you may have a second job at home. But actually, even though that's giving you a lot of comfort there and then, alcohol, unfortunately for women, we need to reduce it in our 40s and 50s. We can't metabolize it, it increases our health risks. So it's adopting a healthier behavior for yourself. And exercise is the key. Even if it's just walking around the block briskly every single day, it can help, because it reduces your stress response, and it produces happier hormones, and you can think clearer. And once you can think clearer, you make healthier choices. You don't feel overwhelmed. Now, if you manage to do all that and you're not getting any better, that's when you go to GP for help. And your GP should rule out everything before you discuss what it is. So that's easy for someone who's midlife. Someone who's younger, it's exactly the same, because I wouldn't want something like early menopause or premature ovarian insufficiency. That's what it's called. Anybody under 40, I wouldn't want that missed. So you put all your self-care in. Then if it doesn't work, you go to your GP. Now that's the woman or the person trying to attempt to solve it themselves. There is another response from the workplace. So if the workplace has supportive policies, that's okay, flexible working, or just a boss that listens. That's all sometimes you need, is someone who's understanding that. You might have, the larger corporations have employee assistance programs, and a lot of them have menopause support on there. You may have mental health first aiders. There may be lots of things in the workplace to support you that you're unaware of. So I'd ask people to check that out. So and then obviously your family and friends, being able, women are good. We like collectively getting together to support each other. Unfortunately for men, our culture doesn't allow that, and they have tough mental health symptoms. Women like getting together, spending time with your friends, spending time with somebody for half an hour, just you. We're not very good at giving ourselves permission to take half an hour or an hour just for you. We're not very good at that. So I'm here to give anybody a permission, if you have it, that you need to invest in yourself to reduce your stress response in however you want to do it, in a healthy way.
Yeah, because that thing, I know I do it myself. It's like, no, I can't take that 10 minutes out my time right now because I need to get all these things done first, and then I will relax. And I do it a lot,
I do it.
Yeah, and it's changing that thought process and thinking, no, I'm going to take that 10 minutes or half an hour now because I know I'll be able to be more productive and get the things I need to do done probably a lot quicker, maybe, and even if I don't, ultimately,
It doesn't
what's the
matter.
worst? It doesn't matter. What's the worst that's going to happen? It is not life or death. That thing is always going to be there. That, whether it's emptying the dish or whatever that thing is, it will still, that task will be there probably every day of your life. It's reframing the way you think about these things. And yeah, I think the self-care, people don't think about that anymore, and they think it's become like a bit of a taboo thing as well, like, oh, self-care, what does that mean? And I haven't got time for self-care, and it's a bit.
And yes, and it's become an industry, hasn't it? And some people don't recognize themselves. Yeah. So obviously in my culture, yoga, stretching, my dad does it. He's 82. He does it every morning, stretches. He goes for a walk every single morning when the sun comes up.
Yeah.
He does that. And I recognize that as good health. Now, trying to do that here, I have to book a yoga class that costs money and time. It's reframing it that no, you just get up and stretch. It's not a fairy pink fluffy, let's go and do a yoga class. I am a yoga convert, can I just say. I've been advocating it for a few years, or telling people to do it, not knowing much about it. And then when I started it, I thought, oh gosh, who knew this works? It does make you feel better. Yeah. But I'm in a position with my children in their 20s. I can go to a class. 10 years ago, I couldn't have taken that time out. So I completely appreciate the constraints and the challenges that we have. So just get up in the morning and stretch. Yeah. Look at your cat and your dog and how they stretch in the morning, and babies, when they wake up, they stretch. Yeah. I used to wake up, sit in a chair with a cup of coffee and then wonder why I was stiff. So it's reframing it. Exercise shouldn't cost anything. It should not. It's free. Getting outside, 10 minutes, brisk walk, 15 minutes if you can, half an hour be phenomenal. Yeah. Stretching and breathing. Anybody can Google the breath exercises. I'm not here today to start talking about them, but you can reduce your own stress response. And athletes do it before a race. People do it before an interview. You can do that. So instead of thinking, oh my God, the world's ending, I'm going to lose my job, which I'm going to lose my mortgage, and that means maybe the kids are homeless, and because you've had a hot flush, or just start your breathing in and out so you can challenge yourself and talk to yourself a little bit more kindly and go, do you know what, this will pass. Yeah, that's ended on a lovely note. Thank you. I just want to ask one final question. Okay, so there's this saying that goes around, wherever really, stress is the #1 killer. I don't know that it's not, well, I shouldn't say it's a saying, but a lot of people say that. What are your thoughts on that? Or should I say distress? Distress is, the #1 killer. Yes. I've heard this phase. I only asked that because I've heard this. Yeah, no, it's interesting. It's interesting because distress produces all those symptoms that I talked about, then produces some physical responses and mental response in your body. So you could say distress is the #1 killer, or stress is the #1 killer, as everybody says. However, that puts the responsibility on the individual, and it's not always the individual's responsibility that's caused them to have some of the symptoms. So stress is not the #1 killer. Stress is involved in, it's a part of the process that does limit our lives earlier. That's how I would say it. which doesn't look good. That's not a soundbite, is it? That's too long of a sentence. So
that's fine. You've explained it. So that's the main thing, because people just hear, stress is the number one killer and I'm feeling stressed and, how can I de-stress and blah, blah, blah. But the way you've put it is, it's not always, the onus isn't always on us. And it's not always, I'm stressed because it's my fault.
That's right.
And that's probably not usually the case, to be fair. But yeah, no, the way you put it, it explains it I know it's not a strapline way of putting it, but you've explained it, which is what I kind of wanted. Yeah. Emma, thank you so much for being on the Empower Her podcast. It's been great to have you on. And thank you for I know we've had a long conversation about stress, but I just wanted to emphasize that and also bring in the menopause and the midlife part of it as well. So thank you for, your explanation and your insights. It's been great.
Thank you for inviting me.
Thank you. Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.